One in 5 Americans will face mental health issues in any given year. If all 57 million Americans with diagnosable mental illness were in one state, it would be larger than New York and California combined. And over 3 million of those diagnoses are very serious: schizophrenia, post-traumatic stress disorder, etc. Our rate of suicide is on the rise, yet the number of psychiatric beds in the country continues to fall. While there seem to be more pharmaceutical treatments than ever for all kinds of disorders, many serious illnesses still go undetected and untreated, sometimes resulting in tragedies we see on the news. But all the tragedies aren't mentally ill people hurting others. Actually, people suffering from mental illness are more likely to become a victim of violence rather than a perpetrator. Not too long ago, we chose a path of reducing psychiatric hospitals in favor of treating patients in community settings. While this served in helping many citizens to live fuller lives outside of institutions, it also saw an incredible number of individuals fall through the cracks, ending up on the streets. Although our system itself isn't perfect, we can all agree that there is room for improvement, with the nation's healthcare professionals continuing to adapt to the growing number of mental illness patients. We ourselves need to refocus our attentions to those of us that need our help the most, from our own families to those throughout our communities. The following 3 options present different views of how we can face this challenge together. Each option also presents its individual drawbacks, so we carefully consider the unique trade-offs before pursuing any such action. So, what are our options? Option 1. Put safety first. This option would make public safety the top priority and supports intervention, if necessary, to provide help for those with serious mental illness. While the majority of people suffering from mental illnesses are nonviolent, the rare instances when they end up harming themselves or others are so unpredictable and dangerous, we have to do whatever is necessary to prevent that. So, what could we do to reduce the danger to society as a whole? What if we required mental health testing for individuals seeking employment in sensitive jobs, such as teaching and security work? We could also empower medical boards with the right to penalize doctors who fail to spot the serious warning signs of mental illness in their patients. But in doing such testing, we could almost certainly deny some rights and privileges to people who suffer mental illness but aren't dangerous. Medical care providers may begin to overdiagnose mental illness just to avoid penalties. Even worse, individuals might avoid treatment by a medical professional altogether for fear of becoming a target of misdiagnosis. Or, what if we created a nationwide system for reporting hospital visits or encounters with the police by those with potentially dangerous illnesses? But, again, chances are that some individuals who aren't really dangerous would be treated as a threat. Could we live with that? Option 2. Expand services. This option would make mental health services as widely available as possible so that people can get the help they need. Right now, a full third of Americans live in areas with a shortage of mental health services, from therapy to medical services to continuing support. So how do we get more mental health services to the people who need them? What if we required mental health practitioners to serve residencies in rural or underserved areas? But many medical students might choose to avoid specializing in mental illness if they don't have the freedom to choose where to work. We could increase the amount of public mental health services available to people, and we could also provide convenient mental health screening sites throughout the community. All these things would have a cost, of course, but not only that, these actions might lead to some people getting over-medicated, while other people still might not get tested for fear of the diagnosis. Could we accept this? Option 3. Let people plot their own course. This option says that the sheer number of feelings and behaviors we call psychiatric disorders is the problem. That we're medicalizing every aspect of life and turning too many people who are simply different or eccentric into patients. So what could we do to reverse this trend and respect people's individuality? We could restrict drug companies from advertising prescription-only drugs on television, but this interferes with both people's right to find out about treatment possibilities on their own and companies' ability to let people know about their products. The medical community could ratchet back its diagnostic standards for mental illness to allow for simply odd or eccentric behavior. What if doctors could prescribe less medication and more counseling and talk therapy? And what about increasing the numbers and visibility of self-help communities like 12-Step and other support groups? But with all these actions, we might be denying some folks the relief that medicine and professional therapy can offer. We could miss some early signs of a serious underlying mental illness. These three options are a starting point for us to look at ways of reducing the impact of mental illness in our country. Sure, the subject matter isn't easy to take on, but if we begin working together in an effort to remove the stigma often attached by society to mental illness, we can better serve our fellow citizens in need, now and well into the future. So, let's start the discussion.